Um, what I'm going to do for the next 10, 15 minutes is just take you through the work that we do and why we set up the Indoor Air Quality Society, IAQS, why we believe it's important, and just a very brief discussion on a couple of the projects that we're working with. Hopefully, the technology is going to allow me to do all the things that I wish it to. Uh, um, so I'm just gonna talk through very briefly around why we believe indoor air is important, and the importance of collaboration across this and using data to um, improve the environment that we live in. Um, who we are, first of all, we're a not-for-profit organization. We're based in Belgium, although we are a collection across Europe. I'm based in UK. Marianne is in the south of France, and we have various academics in elsewhere in UK, in Amsterdam, in Germany, in Turkey, and a couple of other places. We try and bring those experts together and link up with mainly industry to push the research, the advocacy, and ultimately the change within the environment that is indoor air quality. Um, and there you have it, that our goals, educate, inform, but ultimately to improve, because we can educate, inform, but if nothing changes, we actually are still breathing the same air that we were previously. We run a number of projects in association with either industry partners or charity-based partners, which is the Philips Foundation that I'll come on to mention later. So what's our ambition? It's to contribute to research, sharing of information and knowledge, but also through that research on the ground to creating that data collection that then goes into the public domain, becomes public education and advocacy. One of the things that has come out very much since the COVID pandemic is the quality of air that we breathe is incredibly important. However, it is unregulated. And if you go back to something like water 20 plus years ago, that was also an unregulated industry, where now water quality has a lot of rules, regulations, ISOs, etc., around it to make sure that the water that we drink and we use in our daily lives is safe for the public. We don't have that same environment with the air, and that's one of the things that we're looking to try and use through a combination of data and research. In very simple terms, the reason for this in a large part is the air around us is invisible, and therefore if you can't see it, it's not going to harm you, and therefore it's all fine, isn't it? But in reality, the air that you're sat within the room today, there will be a range of different pathogens, particles that may be harmful or may not be harmful. And that is what we want to bring out to a greater acceptance, so that there's a greater understanding, and therefore turn that invisible into the visible. Just a few things. We're not alone in this. The World Health Organization have been saying this for a considerable length of time. And they would recognize air quality as one of the greatest killers across the world. This is generally, when they talk about it, outdoor air in poorer countries where they're still very often cooking with open carbon-based fuels, which means that the pollution levels are high. However, we spend the majority of our time indoors, and on any given day or given year, you will spend about 80% of your time indoors, and during that time you'll inhale and exhale about 6 liters of water at least 6 liters of air every minute. And unless you know what is within that, that can have a significant effect on your health. And the slide, it says a number of elements that we would recognize as being some of the greatest killers across all environments, whether that's first world or third world. So how is this made up and broken down? So what factors do affect us? It can be poor air circulation, fine dust, toxins. Not all of those VOCs, so volatile organic compounds, are bad for us. However, identifying what is bad and what is good is not quite so easy. CO2, where can be helpful in some ways, can also affect us in terms of concentration levels. You're probably breathing quite a lot of CO2 and pushing that into the room. As the day wears on, you'll probably find yourself more sleepy than you were when you first arrived. There's been a lot of studies being done in indoor air quality in schools that show that if you have monitors and systems to remove the CO2, the concentration levels of children and the performance levels of children are significantly improved. We can go on and talk about spores and molds. Those, particularly in UK at the moment, are very much topical in that there's been a number of deaths from poorly ventilated and poorly maintained housing, and particularly in vulnerable children. You'll see there from the slide that in the everyday life we will have, from cooking, from cleaning and detergents, from the condensation in bathrooms. All of these affect both the air that we breathe and therefore the health that we experience. So to touch briefly on two projects that we're working on in IAQS currently. The first is something that we've been working on in just over a year now, and it's a project that tries to bring together the both effects of air and also how that affects buildings themselves in terms of either the building efficiency or the carbon effects of buildings. One of the things that we discovered when we first started looking at this is that research tends to be relatively isolated in this environment. It tends to be either very heavily delivered within laboratories, which are useful as indicators, but clearly it's not the real world, and therefore actually is that a true representation of what's happening in the air in each building? Or it tends to look very specifically, if it is in the real world, at a specific, such as a CO2 or PM, so a particle, it's a matter of, say, 0.5. What we're looking to do and what we're doing within this study is take it to the real world and look at how not just what's in the air within a particular space within buildings, but also how it moves. So using computer fluid dynamics and associated with testing for particulates, VOCs, and the microenvironment, we will look at all of the elements that sit within the air, how the air moves around, and also look at some of the potential solutions that are out in the industry at the moment in terms of mitigations. Our idea is that we will use two major European cities, probably a Belgium city and another European city, TBC, at the moment. And we will look at the space, we will test that space, and we will use that data to educate, inform, as I've said previously. But the idea being that we will use this to support the legislation and also support companies in terms of how they're pushing the industry as a whole. The second is in collaboration with the Philips Foundation, which is the charitable foundation of the Philips organization. And this is looking at the effect of air and the indoor air quality associated with cardiovascular disease and cardiovascular health outcomes. So the patients in question within an area that is based within Amsterdam will look at and will have regular tests. So they'll have regular CTs that will test the progress and the progress of their disease and the general health outcomes that they're experiencing. With all of these patients, we will be sending them with a monitor and look at the air quality within their home or their main residence, and will then compare that and use that to both look at the effects of air quality on health outcomes, but also look at what that means from a socioeconomic point of view, as very much we'll be looking at different areas within Amsterdam, of which there's quite a range of socioeconomic backgrounds. Those are sort of two of the projects we're working with at the moment. We're very much looking to go and do other industry tests, and we've got a couple more in the pipeline. We'll be doing these studies over the next 6 to 12 months, and then be looking to publish that data, peer reviewing it, and start to create a library of information around the information we create. Just as a closing thought in terms of what this means, it's a relatively well-recognized fact that wealth can influence what a healthy life means, and that can add up to within Europe, within 9 years to a healthy living. The environmental factors that sit around you every day and sit around you in the building you are now has that same profound impact. And therefore, what we are looking to do is you can have no greater wealth than your own health, and therefore we should be looking about how we can improve that, how we can look to look at new projects and create that understanding that ultimately moves us from the invisible to the visible in terms of understanding. These are some of the companies we operate with and work with. We're a society, so as I said, we're not for profit, and therefore we link in with a number of industry or other associated organizations. I just wanted to say thank you, and I'm sure Marianne, if she was here and was able to, she would also say thank you very much. So thank you for listening. I hope you found that interesting. I'm not sure if you are going to have any time for any questions or not, or whether we move along now.
Well, thanks so much, Jon. This was really informative. Round of applause.